was just really difficult, and there was no support and no understanding of this disease. Even my family, I don't think, really understood the seriousness of the disease until I couldn't walk anymore, until I had so much joint damage done that they had to know something really bad was happening.
For a while they were thinking it was an allergy of some sort. I was at a point where some of the numbers of the counts of different parts of my blood were at a lethal level. So when they finally discovered what it was, I was rushed to the hospital.
I went from being an Olympic caliber athlete, leading what I considered a very healthy life and lifestyle, to being wheelchair bound in about a month.
Ça change une vie d'une façon terrible, en ce sens que qu'est-ce que je vais faire demain? Est-ce que je me ramasse en fauteuil roulant? Comment je vais faire pour faire vivre les enfants, faire vivre la famille? Est-ce que j'ai les moyens financiers de continuer? Est-ce que? Et il n'y a pas de réponse pour rien.
Arthritis represents really over 100 different conditions, so that's arthritis and other bone and joint conditions that can affect any age, that babies can get arthritis and people over 100 can develop arthritis. So it crosses the spectrum of age. It can affect men and women. It can affect people of all races and creeds. The Alliance is a collection of over 30 stakeholders, from people living with arthritis, healthcare professionals, researchers, governments, corporations are all involved in this, and collectively we can make a difference.
C'est la première fois que toutes les associations de l'arthrite sont ensemble. C'est quand même une étape très importante et très significative que maintenant il y a une seule voix pour l'arthrite.
Success for the Arthritis Alliance is really about delivering on the strategic framework that we launched in September of 2012, where we articulated 3 fundamental priorities for action. The first is raising awareness of arthritis and dispelling the myths that nothing can be done. The second is about improving delivery of care for people living with arthritis. And the third is really about strengthening and enhancing our research capacities in terms of the research focus being a patient-centered focus.
Because arthritis is so common, and arthritis is something that is developing over years and manifesting over years, it really isn't perceived as an important problem in society.
And I think that most people at the public level, when they hear the word arthritis, have no idea that there are all these different types, like rheumatoid arthritis, that are as impactful on one's life as cancer, as HIV.
For 20 years that I was in practice, we have very little to offer to our patients. I felt like somebody walking in the desert without any water.
Because I see primarily patients with inflammatory joint disease, inflammatory arthritis like rheumatoid arthritis, my career has changed dramatically in the past 10 years because of these new, very effective therapies. The people are doing really well. No longer we have hospital beds full of patients with inflammatory joint disease that can't move.
Finalement, après 8 ou 9 ans de maladie, j'ai commencé les agents de rémission qui sont préconisés aujourd'hui dès le départ, qui s'appellent les antirhumatismaux, comme le méthotrexate. J'ai commencé ça 8-9 ans après le début de ma maladie. Et aujourd'hui, ce que je prends, c'est des anti-inflammatoires, je prends du méthotrexate et un agent biologique, et ça fonctionne à merveille.
The advent of biologics was huge. 12 hours after I took my first dose of that type of medicine, which is sort of the newest type of medicines to treat my disease, 12 hours later, my husband and I interlaced our hands together for the first time in our married life, which sounds really kind of corny or simple to a lot of people, but you have no idea what that feels like. It's incredible.
Speaking with one voice, no matter where you are in the arthritis community, can only lead to better results.
As a patient, one of the things that I learned early on is that the squeaky wheel gets the grease in the healthcare system. People with arthritis, there are 4.6 million of us in this country today, and we need to unite to advocate on behalf of ourselves, but on behalf of our entire community of 4.6 million. it's so important that we talk to our friends and neighbors about our disease, because only then will others around us in those broader sort of concentric rings, like employers, like government, only will they learn if people like me exercise our right to speak out about what's affecting us in terms of our health and arthritis.